Hello, long time no see. Yes, I was really not very happy, I should say, when I saw that you have booked an appointment, even though I've seen you quite some time ago, but maybe I'm not a very good doctor, as I'm not interested in you being unwell, and that's why. Yes, my dear. So, what made you come today here? Have you rested well? Okay, let me check your file, okay? Your date of birth, please just confirm. Okay, great. When was the last time that you had your cycle? The first day of it. And how long does it last? Okay, is it painful? How do you feel before and during? You experience some cramps. So, do you need any kind of medication? Okay. Right. And are you currently breastfeeding? Are you sexually active? And regarding the partners? Okay. Yeah, I mean, if they are changing, then we need to make some tests and so on. Okay. So, please tell me, what is happening with you? Okay. Have you done recently any tests regarding the infection? Okay. Let me check then your file. Do you remember the approximate date? It was in another clinic. Yeah. Okay. Yeah, I see. I am opening it and I see that there was an infection and you've had prescribed. You okay? But I do not see if you have made another test after a month or two, just to check if the infection has gone. Do you remember anything about it? All right. Yeah, because they did not put any information in this file. Okay. Do you have any allergies? Okay. And what do you consume regarding the supplements and, everything? Okay. Okay, so you're telling me that you are experiencing bad smell. And what about itchiness, redness? No, it does not necessarily it is not necessary that your partner has the same infection, or it is not, we do not have the proof that this is an infection. I will check, I will examine you, and we will see what's happening, okay? But you have to be not worried at all. It should be very relaxing, okay? I have as much time as you need. And of course, it is very, it is a good thing for a woman to take care of herself, okay? And our goal is today to bring you back to health, okay? To the harmony, your whole system, your whole body. So we'll see what's happening. Okay. At first, still, I will be checking your pulse, okay, and the way you breathe, the way your heart works, okay? Do you have any cardiological issues? Okay, and anyone from your relatives have ever experienced anything related with the female illnesses? Okay, cardiology. I see. Okay. Just breathe normally for me, please, okay? Okay. Yeah. I will get a bit closer. All right. Okay. Do you want me to check your lymph nodes as well? Do you do any breast exams at home? Yeah, after the menstruations, this is the best period. Okay, I will come to your back, okay? All right, and now I will take your wrist, okay? Yep. Okay, here we go. All right. Have you ever before remember that you were having some similar symptoms? Okay. All right, my dear, so now I will ask you to lay down, okay, and I will just go down there and take a look, okay? Yeah. All right, my lovely. So I am going to take a look what's going on there, okay? I know this is not your first time here, so I believe that this time you're quite calmer. Okay. Just taking a look there, okay? All right. going to palpate, okay? When I touch here, do you feel any discomfort? Okay. When I touch here, okay, now going to your pelvic area, okay, so when I touch here, alright, yeah, I'm just going to touch a few more points, and if you feel anything that brings you any kind of discomfort or pain, just let me know, okay? Of course it shouldn't, but in case, okay? Alright, here all looks beautiful. Now I'm going to take some swab, and we are going to make a test. Just preparing everything. How do you feel there? Good? Yeah. So I'm going to insert it, okay? And take a little example, okay? Of those bacteria or any organisms that are alive there, okay? Alright, I suggest you to take a deep breath in and slowly breathe out, okay? Just take a deep breath in and breathe out, okay? Yeah, I'm sorry, I know it might be really uncomfortable. Okay, I got it. Alright. Good. Perfect. So now you can just get up, okay? And we are getting back to our examination, okay? Okay. Alright, so we are back to normal. I am putting the discharge from your vagina into this machine that I have, and we will see what are going to be the results. What about any other symptoms such as discharge? Okay, but the smell that you have described, is it constant or it is stronger after your cycle ends, or before that, or after sex? Okay. Okay. So let's see what we have here. Okay. So good thing, no founded infections. Okay. Oh, I see. Okay. I see, my dear. We do have the results. There is no infection, and just your vagina's pH has changed, and also, yeah, the diagnosis, what we see today is the imbalance of the good and bad bacteria, which, yeah, okay, yeah, all right, Okay, I'm fixing and putting it to your system. So this we call as bacterial vaginosis. Have you ever heard anything about it? Yeah. So no infection, that's good. Yeah, but we are going to treat it with good bacteria, okay? Of course, I will prescribe you some medicine. Yeah, this will be it. The tablets, vaginal tablets, okay? Yeah. All right, 6 tablets for 6 evenings, okay? So I'm just writing it down. 1 per day, okay? 6 days in total. Before you go to sleep, you just insert it into your vagina, okay? And it will dissolve. So this will be as a recreating your pH and also recreating the whole atmosphere, let's call it like that, in the bacteria, okay? It's not correct to say kill bacteria, bad ones, but it kind of works that way. And then after you end this, then I will provide you some more medicine. So then after those 6 days you will take this, okay? These are also the capsules, vaginal ones. So it means that these are the good bacteria. You keep it in the fridge, okay? And each evening for 6 days, just after you get the medicine done, you are working out with this one to recreate the balance of the good bacteria, okay? Perfect. And then I also want you to drink probiotics, the feminine ones. It will be for your feminine health, as well as your intestines, because it is very related, okay? And yeah. All right. I'm going to take a few. And add to the bag, okay? So 1, 2, 5, 6. I will prescribe it, like 15, okay? So 10, 12, and 15, okay? If you feel after 2 weeks that you still feel the symptom, you still feel that bad smell, what you are doing, you are buying again the same probiotics and good bacteria for your vagina, okay? It may take for 2 months to balance the atmosphere, okay, the being of your vagina and bacteria out there. But I also have a few questions. What about your diet? Just describe what you eat, what you do not eat, how much, if you consume any sweets, then how much, how often, what kind of sweets. Okay, yeah, because sugar, it is the biggest, how to say, enemy for our intestine and get bacteria. All right, so okay, I see. So I will ask you to lower the consumption of those sugars, okay, and wheat, okay, as much as you can, okay. And if in 2 months you won't see any difference, then of course we are meeting again and then testing, making a broader test and for the other kind of infections, okay, which would be related with your partner. But these are not transmitted sexually, no. Bacterial vaginosis, no. If only your partner feels any kind of symptoms for himself, then maybe the pH is also imbalanced. Yeah, but of course, don't have any sexual contact for the 6 days at least, till you will consume all of the medicine, okay? And then before putting the vaginal tablets of good bacteria, and then before that you may. Okay, so I'm going to call you in 2 weeks and we will take a look what's happening, okay? I will also send you by email the recommendations regarding the diet, about the fats, about the carbs. Of course, drink as much water as possible. And one more hack for you. It's very important so that you would wear some, let's say, cotton material, the underwear, okay? Not synthetic, okay? And then if you want to, you can put a little tiny bit, 1 drop of lavender organic essential oil on your underwear, because it also works, it treats in no good way the parasites, okay? Yeah, that's a hack. And tea tree oil essential one, but just choose the ecological ones, good? Of course, the stress prevention, very good rest, all right, and good sleep. I'm not prescribing it, but you can use magnesium, and at least 2 evenings before going to sleep, you may listen to ASMR. The one that calms you, of course, yeah. Alright, my dear, so wishing you good luck, okay, and good rest and good health. Alright, bye. Very well.